guys, it's Suzie, just checking in. So one of the biggest questions I've been getting recently, personally from friends, and then one of the biggest questions we've been seeing coming through on our chat with our different nurses is, how do I find a doctor? How do I find an OBGYN? What should I be looking for? Where can I find them? And today I'm going to go through a couple of tips and tricks that I found really helpful when looking for a GYN. Okay, my first tip for you guys is, if you have health insurance coverage, which I hope all of you do, you want to go ahead and figure out what your network is. So on your insurance card, it should give you tiers or levels of networks that you are capitated to. And that means where you're essentially covered without a copay. What the next tier might be a slightly higher copay, and then the tier following that is going to be the places with your highest copays. And if you can find a provider that is within your network, meaning you don't really have to pay a high copay for a family practitioner, that's what you want to look for first. Once you've identified sort of what's in your network and what you can afford, you're going to do a deeper dive of research. Gather those physicians together. So you want a family doctor, and then you also want to be looking for an OBGYN. For a family doctor and a GYN, you can turn to specific sites like Health Grades, where you can identify different statistics and reviews on the various providers to find the right fit for you. To take it a step further, once you've sort of curated a list of your top 5 or 10 providers, you can go ahead and talk to your friends, see if any of them have gone to these people, see what they think. But most importantly, you want to find a provider who seems to be in line with what you're looking for in terms of health goals. Notice if in the reviews on that provider, they've taken time to actually sit down with their patients and review different information with them, rather than just sitting and typing the entire time. Physicians are required to meet certain metrics and requirements due to our rules and regulations around healthcare. So that's often why they're going to be in a room charting, and it's really hard for them to sort of meet those requirements but also pay attention to you. So try to find someone who really takes those things seriously and is going to give their full attention to you. The reason why you want to have a physician is because there's still going to be a lot of things that you need to go into the office for, especially when it comes to women's health. So if you need some blood work done and you're interested in hormone panel testing for your pap smears, if you're going to go in and see someone, and then you still really want a once a year checkup with your family doctor. So I hope this was helpful. You guys are just absolutely incredible. Thanks for staying along and spreading the word to all of your friends. We cannot wait to keep helping you even more than we already are.